The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. Hello, everyone. Welcome back to another episode of the Dental Download podcast. Thank you all so much for tuning in this week. We're doing another solo episode, but the topic is about should you or should you not do a general practice residency or advanced education and general dentistry residency? So those 1-year residencies after dental school. Is that right for you? Should you do it? And maybe a little bit about why I did not do one after finishing dental school at Michigan this past May and now being a little over 1 month into working. Before we get into all of that, we're going to do our weekly catch up and our weekly intro that we do for our solo episodes. So, life updates. Things have been really good. I just had my birthday on Friday, so I'm officially that fun age of 26 where you have to start doing even more adulting, more bills and insurance and all that fun stuff. But I was able to work that out through the Michigan Dental Association's insurance agent helped me get a personal health insurance plan and stuff through Blue Cross Blue Shield of Michigan. And that was nice because most dental offices don't offer health insurance, I would say, if you're going for a private practice role, because usually you're not even working full time and you are compensated well enough to pay for your own health care. It just feels a little annoying. Eventually, I'll be on my spouse's plan once we are married, but since we're just engaged, I'm going to have about 1.5 years where I need to pay my own way when it comes to insurance. But my birthday was lovely. I spent it with friends and family, and I'm feeling very recharged going into another week of work. Last week of work was a little bit on the lighter side, I would say, for Tuesday, Wednesday, Thursday. But Monday, I did a really big case with 2 crowns on the left side and a bridge prep and an extraction in the site of where the Pontic will be. And then we temporized everything. And then when he comes back, we'll deliver the bridge and do another crown. And when I say crowns for our case for the office, you can always assume it's a prep and delivery same day because we do all the milling in-house. And the span of the bridge was short enough that I'm actually designing and milling the bridge in-house as well. But we needed to give the extraction time to heal. So about 5 weeks after that appointment, we'll have the patient come back and get his new bridge and then do the crown on the other half of the mouth and have him kind of have a whole new bite, no more broken teeth, and hopefully we'll kind of get that occlusion in check for him to somewhere where it works good for his jaw joint and his natural bite. That was kind of the biggest thing I was stressing about with the case was making sure the occlusion is going to be good in the end, considering left side bridge and crown, lower left crown, lower right crown, basically affecting the whole bite. So that was my big case last week, but it's still in process. I don't have much to share with that yet. And I also filmed a couple days in my life vlog last week, as well as updates about some of the wedding planning things, the car shopping things. So that's going to be up on YouTube in about a week or so. So make sure you're following my YouTube for my Dr. Haley saga. It's always a bit of personal life over there as well, too. It's definitely not all dental related. So if you're at all interested in life of a person that is a dentist, I would check out my YouTube channel and then my Instagram, which is Dr. Haley DDS. My rec of the week is going to be using recipes for ingredients that you have around the house. You can see my recommendations are very, I would say, budget oriented these days, but that's life as a fresh grad dentist. I'm very much money conscious at this point. So I would say going through your fridge and seeing what you have and then trying to make meals out of that, looking up, like Spanish rice and chicken and tomato recipe, and then cooking that rather than going and buying different protein and different veggies and things that you didn't need to because you had some stuff around the house. At least building off like your pantry and anything that's about to expire, making sure you use that up would be my recommendation of the week and something we've been doing. What's motivating me this week is still kind of coming off of that break we had at the beginning of July has really made me feel more fueled up for finishing the month of July out strong. And I'm also looking forward to the next couple of weeks. I definitely have more of a consistently full schedule, thankfully. So with the onboarding throughout June and some of July, there would be days where there wasn't a lot of space for them to put patients on my schedule. So I was kind of just bouncing between operatories, a patient here and there, rather than having like my own set column with my own room and my own assistant. But going forward, that's pretty much going to be standard now. So I'm looking forward to kind of having my own space and getting into my own groove. There was definitely benefits to working with all the different assistants and working in all the different operatories because they're a tiny bit different. Some are newer than others, but I'm looking forward to kind of stabilizing in and getting in my groove and hopefully ramping up my production a little bit more. Just feel like I have had days where I've had a full schedule and been very productive, and I know that that's very attainable for me. But some days if the schedule's not full, then I know I could be doing better. And one thing I learned this week, oh my goodness, there's so many things. Probably the thing I'd want to talk about most would be this book that my boss gave me, the owner doctor. It's called Exactly What to Say, I believe is what it's called. It's only like a couple dollars on Amazon, like less than $10, a little soft copy book. And it just gives you different phrasing you can use to open people's minds a bit and get them more open to discussing things with you. This is a very broad book. It's not dental specific, but in our case, it's probably getting them more open to dental treatment for understanding why this is important for their health. So that's a book I would recommend checking out. So now we can get into the main topic of the week, 5 questions to ask yourself to decide if you should do a GPR/AEGD before going into the real working world. And these are things I've been thinking about a lot because I've been realizing, oof, man, I really got to push myself here. And if I was a different type of person, or if I wasn't exactly at the skill level that I was upon coming out of school, maybe I wouldn't have been able to push myself in that moment. And maybe this wouldn't have been the right step for me. But I feel very happy with my decision to go into practice. And most states around the country, you don't need to do a residency to practice in. There's only a few. And I think people get very hung up on that, especially like East Coast, I would say, like Northeast. It's super, super common to do a residency. And that's kind of the expectation if you want to practice in those handful of states and just like what a lot of your classmates will be doing. But if you want to go Midwest, Middle America, somewhere that's a little bit more in need of dentists, you absolutely do not need a residency to get a job if that's something you're worried about. And it's more up to you to know your own confidence levels and your skill levels. So, first question to ask yourself, will you say yes to any same day procedure thrown your way? So, if the doctor or the hygiene tells you this person might have something you can do today for them, and you walk in and you diagnose it and there's chair time available, are you going to be comfortable to just go in and do it? Do you feel like you need to prepare for days and hours for cases? Obviously, some things are more advanced and you're going to know your own limits, but essentially not letting fear scare you away from taking on something with very little time to prepare. And maybe it could be something that you haven't had much experience with, or maybe technically any hands-on experience with. You might have watched other people do it or learned all about it. So do you feel comfortable enough to go and do it? And again, to me, I would say yes. Obviously, there's some things that are out of my scope. I'm not going to just go and place an implant yet, but most like general dentist procedures, do you feel comfortable going in and doing that on a moment's notice? The next thing, number 2, can I critically evaluate myself and take initiative to learn from my mistakes? And then the second part of that is, can I handle this mentally? So as someone that doesn't have a preceptor anymore, you are your own critic, you're your own teacher, you're your own everything. Yes, I have mentor doctors in my office and everything, but you need to be the one that's looking over all of your work. You need to be the one that's following up with your patients. You need to be the one that's evaluating your post-op x-rays, or when the time comes for me checkup x-rays in 6 months or whatever it may be, and learning from your own mistakes, seeing how you can get better, always thinking about how you can improve. And are you going to take initiative to go home and watch CE, talk to more people, ask more questions? Are you comfortable to ask questions and to admit when you don't know something or when you struggled with something? Are you able to go in that vulnerable position and kind of take yourself a step down to actually learn? Or do you need someone that's going to kind of put a path in front of you and tell you what to do to improve? Because when you're out working, you need to do that for yourself. So can you handle that mentally? Are you someone that takes initiative and more of a go-getter? And can you handle like the negative self-talk in a way and the self-critique in a way to make it productive for yourself and not in a way where it's going to affect your mental health or just not push you towards improvement? Are you going to do it in a way that's harmful to yourself rather than helping you improve? Like you would understand which direction you're going to take that, knowing your own personality and your own mental health. Raise your hand if you've been putting off getting disability insurance. Jim Katchmar from Doctors Disability Specialists can help educate you about your options. I have personally worked with Jim to ensure that my strategy is appropriate for me. He took the time to explain key terms and make me feel really good about my decision. If I were to describe Jim in a few words, I would use knowledgeable, kind, and collaborative. Jim can be reached via email at james.katchmar@ddsteam.net, or you can call him at 207-671-2216. His website is www.ddsteam.net/team/Jim-Katchmar. Reach out for a no-obligation complimentary consultation today. No compensation was paid to this client for their testimonial. Their experience may not represent the experience of others nor predict future results. Thank you again to Doctors Disability Specialists for working with me on this episode. Number 3, am I comfortable paying for CE, or will I be at an office that has funds for my CE? Because you're absolutely going to need CE after dental school. And that's something that I hear often of residency versus practice. Practice, you make X amount of dollars, but you spend a certain percentage on CE to gain skills that you didn't learn in dental school. Versus if you go to residency, you're making less dollars, but you're getting that education built in. So maybe you net are coming out with the same in your pocket after all of that, some people would say. However, I think if you have a good job out of dental school, that's definitely not accurate. I think you're still pocketing a lot more, or in my case, my office pays for my CE, so I'm taking my dentist salary and using it for my personal finances, and the CE is through my office. And it's not like I can just add to cart $10,000 of CE without talking to my office and getting it approved, but in general, they are going to be supportive of that continuing education. So you want to know, are you ready to make that investment in CE, or do you have a way to get that CE funded? Because you do not want to go in expecting that you know everything you need to know from 4 years of dental school, because that's probably inaccurate, or you're at least not keeping up with the times and trying to advance your skills like we were talking about before. If you do the exact same dentistry that you did in April when you graduated dental school for the rest of your career, that'd probably be a bit problematic because dentistry is always evolving, and you would hope that you want to be continually advancing your skill set and kind of eventually becoming more of an expert in something specific when it comes to dentistry. Number 4, is my confidence in every general dentistry procedure at least 6, maybe 7 out of 10, at least. So to me, that's crowns, bridges, complete dentures, partial dentures, restorations of all types, and kind of understanding occlusion, emergency situations, understanding enough of pharmacology to keep your patient safe, treatment planning, perio, all of that. Do you at least have like a passing level of confidence in those and an understanding? For me, my answer was yes. Some things I felt general dentist scope, 9 out of 10, like very confident. And then some things maybe a 7 out of 10. But knowing my own limits and knowing where I needed to put extra attention towards CE and extra research and help with my mentors before taking on a case that was maybe more advanced in one of those areas that I had less experience in. Again, that's being really able to critically evaluate myself, like we talked about in number 2. And number 5, why are you considering a residency? Just like deciding why do you want to be a dentist in the first place, you should have a really good answer of why do you want to do a GPR or AEGD. If it's to just see the craziest, wildest scenarios ever so that you're more prepared when you go into practice, probably is good for you to be in a hospital setting. If it's you really want to place a ton of implants really quick, maybe you can find a residency that does that, but they certainly don't all do that. If it's because you're just feeling timid and not ready to jump into practice, then maybe it's right for you. I think the main misconception about residency is someone doing a residency is less prepared or less skilled dentist than someone that goes into practice. We're probably all graduating with a fairly similar skill set, to be honest. It's more so interest in dentistry. If they want a more niche experience, they'd go to a residency that has that. Or it would be their confidence in those skills that we're talking about, I think are the biggest things of why you would or would not do a residency. So I've kept this episode kind of short and sweet, but I wanted it to be something that you could quickly go to for, can I maybe figure out, is residency right or not right for me? One thing I want to finish with, my biggest piece of advice that I think was very helpful for me on this topic during dental school. At the beginning of dental school and finishing undergrad, I thought I would probably do an AEGD, not a hospital dentist girl, so no GPRs for me. But I thought an AEGD would be cool. I could move to a new place for a year, kind of get my bearings, solidify what I want to do as a dentist, and then go practice and be more of an eligible candidate as an associate. But quickly, probably by like the middle of first year, I was like, nope, not going to do a residency. Doesn't really interest me. I would rather start practicing, start making money, start putting my roots somewhere a little bit more. I don't really have an interest in moving out of the state and uprooting my life to that degree. But again, a lot of that was like personal reasons too. But regardless, I would say go about your time in pre-clinic and especially in clinic as if you need to be an independent dentist with no help, no supervision come May, June after you graduate school. Even if you think you're probably going to do a residency because you have an interest in special healthcare needs, implants, hospital dentistry, whatever it may be, still get your mind to be ready for fully independent practice without residency, because I feel that you will push yourself a lot more in clinic and you will be more self-critical and understand your weaknesses better and have more of a drive to fix them now rather than waiting for someone else to help you figure out how to improve your skills. So with all that said, I hope that helps you through your decision-making process. Obviously, I'm coming from one end of the spectrum as someone that did not do a residency. So of course, I'm a little bit biased towards that direction, but I have plenty of classmates that are in general dentistry residencies right now and are very happy with their decisions. So I don't think one way is better than the other. I just wanted to shed some light on things you could ask yourself to figure out which might be the right thing for you, and some things that personally I feel if I did not have certain mindsets or ways about me, that I would not be successfully practicing independently right now. So with all that said, I hope you all enjoy the rest of your week whenever you're listening to this, and be sure to follow the podcast on whatever platform you're listening to. And if you really want to do me a big favor, give it 5 stars on whatever platform you're listening to. That helps the show get pushed out to more listeners. And I will talk to you next Monday.